Hi, I'm Jennifer Shelton. I'm a Bluefield State nursing student, and today I'm going to discuss the ethical issue of vaccinations, specifically the question of whether childhood immunization should be mandated. I selected this topic for two reasons. The first one, being a mother, I want my daughter to be protected from all illnesses as much as possible. And secondly, as a nurse, I want my patients to also be as healthy as possible, and I don't want to contract something and bring it home and infect my family. Vaccines are substances that are introduced into the body to allow the body's immune system to produce antibodies against the causative agents of disease, and these include both bacteria and viruses. There are vaccines available that were created to defend against a number of well-known diseases. These are things like diphtheria, tetanus, polio, pertussis, measles, mumps, rubella, varicella or chickenpox, hepatitis A and B, Hib, influenza, pneumonia, and rotavirus. Most vaccines, however, are not 100% effective, but they do have a very high rate of effectiveness. The effectiveness of some vaccinations will decrease over time, so sometimes boosters are recommended. Vaccinations can sometimes be given as a one-time injection or as a series or a set of multiple injections over a scheduled period of time. This will increase their effectiveness. Currently, the United States does not have any federal law that mandates immunizations for children, but all 50 states do mandate that children have certain vaccinations before they enter into the public school system. Most states do, however, allow exemptions. And these exemptions from vaccination can be for medical, religious, or philosophical reasons. Medical exemptions have to be a signed statement by a doctor or medical professional. Religious exemptions need to be a signed statement from a parent stating the immunization conflicts with the family's beliefs and religious practices. West Virginia does not allow any other exemptions other than medical exemptions. And school systems are not the only place where we do require mandatory immunizations. Another facility would be a daycare facility. There are currently no requirements for immunization for any non-public school organizations or activities, things like church groups, community organizations or activities, or sports teams not related to the public school system. For instance, my daughter is involved in 3 different activities within the community. The first one being a dance class through the 4-H club, the next being a t-ball team, and then lastly, story hour at her public library. If children are not of the age to be enrolled in public school, if they're enrolled in homeschool or private school, or if they've submitted exemptions for their children, there's really no way to know if a child has been properly vaccinated. And the only way to determine this is if a parent of a child discloses their child's immunization status. Many people approve of vaccinations and they feel that they help the body fight off infection and disease, while others feel vaccinations are unnecessary and cause more harm than good. I'll be discussing both the pros and the cons of vaccination to determine whether or not immunization for children should be mandated. First, to begin with the pros. Many studies have proven that immunizations are safe and effective even for infants and children. This means that the possibility of contracting a potentially preventable disease is worse, and the outcome of the risk, or it outweighs the risk of receiving a vaccination. Although adverse reactions can occur, they're usually very rare, mild, and they do not last for a very long period of time. And this can be something like redness or soreness at the injection site. Someone may experience a low-grade fever or mild fatigue. Vaccinations have been proven to promote physical health and help with early childhood cognitive development. When a majority of a population has been vaccinated against a disease, this is called herd immunity, It decreases the likelihood that an outbreak may occur. Vaccinations are relatively inexpensive and are often covered by most people's insurance. There is a program called the VFC, or Vaccines for Children program, and they provide vaccinations for children whose parents cannot afford them. So this means getting vaccinated is much cheaper in the long run than the cost of obtaining medical care after a disease is contracted. You may end up paying for things like testing to be diagnosed, paying for medications to treat the illness or disease, as well as your doctor's office visit, ER visit, or a lengthy hospital stay if complications occur. By being vaccinated, you're preventing spreading a disease to your friends, family, and those closest to you. Vaccines have been credited for eradicating many diseases, which means that their prevalence in most part of the world is rare. And most importantly, vaccines help the body defend against disease, and they can save lives. Now to the cons. Many people feel that vaccines contain harmful ingredients. By making children mandate to be immunized, this takes away a parent's right to decide medical decisions for their children and gives it to the government. Vaccines can also cause harm to people who are immunocompromised, and this may be due to a medical condition, chemotherapy, or someone may have a severe or life-threatening allergy to the components of a vaccine. Receiving vaccines are sometimes against people's religious beliefs or practices. Some people believe that natural immunity, which is the body's own immune system, is more effective than to receive an unnatural vaccine. Pharmaceutical companies market vaccines for profit, and some people believe that they cannot always be trusted to produce a safe product. Some studies have shown a link with receiving certain vaccines and the diagnosis of autism. Some vaccines are recommended to protect against diseases that are rarely even still occurring in the United States, and they rarely result in death. Vaccines can also be used to prevent and protect against diseases that are relatively harmless. For example, the chicken pox. And most importantly, vaccines can cause serious and sometimes fatal side effects. How will mandating childhood immunizations affect nursing and health care? It will be significantly affected by a person's choice to receive or refuse a vaccination. The more people that are vaccinated against a specific disease means that they're less likely to develop that disease. Even if people are vaccinated, they still have a chance of developing that disease, but the complications or the result of that disease is usually much less severe. This means that the services that they may receive while hospitalized from nursing staff or other members of the healthcare team would be much less than that for a person who was not vaccinated and developed that disease. Also, the more people who are vaccinated, it means less likely the spread of that disease will occur to those around them. This will result in less people seeking treatment for an illness at a healthcare facility. For example, this past flu season, most of the people who were diagnosed and treated for the flu at the facility where I work were people who had not received their flu vaccine. Often other members of their family had to come in and be treated as well because the virus was spread from the affected person to those near them. Vaccination can potentially save healthcare facilities money due to the illness and disease being prevented, thus less people seeking treatment. But if immunization of children did become mandated, it might increase the workload of members of the healthcare team because they would be administering and documenting more vaccines for children. So in conclusion, I've given an overview of immunization, the current regulations, the pros and cons, and how mandating immunizations could affect nursing and the healthcare system. Now it's up to you to decide whether you think childhood immunizations should be mandated. Thank you.